Hello everyone, welcome back to our health and wellness channel. In today's video, we're delving deep into the world of liver cirrhosis, a serious condition that affects the liver's ability to function properly. We'll explore what cirrhosis is, its symptoms, the underlying causes, and the treatment options available. Let's get started on this educational journey. Liver cirrhosis, also known as chronic liver disease, is the term used to describe severe liver damage. Various diseases or sometimes unknown factors can cause different levels of liver damage, leading to structural and functional impairments in the liver. This is the beginning of the cirrhosis process. As the condition progresses, the liver becomes increasingly hardened and shrinks, impeding blood flow and causing new blood vessel pathways to form. These events further deteriorate liver function, culminating in liver failure. In the early stages, cirrhosis often doesn't show any symptoms. However, as the liver damage worsens, symptoms become more pronounced. Common symptoms include appetite and weight loss, nausea and vomiting, persistent fatigue, swelling in the legs, edema, abdominal swelling due to fluid accumulation, ascites, muscle wasting, anemia, itching, jaundice, impaired blood clotting, menstrual irregularities in women, skin bruising and bleeding, irritability, constipation, gas, and a feeling of heaviness in the stomach. Now let's talk about what causes liver cirrhosis. The most common cause is chronic alcohol consumption. Besides excessive alcohol use, chronic viral hepatitis, particularly hepatitis B and C, is a significant contributor. In about 10–15% of cases, the specific cause remains unidentified, referred to as cryptogenic cirrhosis. Other less common causes include non-alcoholic fatty liver disease, blockage and inflammation of the bile ducts, autoimmune hepatitis, long-term use of certain medications, and excessive intake of minerals like iron and copper. Diagnosis of liver cirrhosis involves a comprehensive approach, including a detailed medical history, especially regarding alcohol use and past viral hepatitis. Physical examination can reveal signs like liver hardness, enlargement, and spleen enlargement. Initial indicators like jaundice, edema, and bruising are crucial. Besides physical examination, ultrasound, other imaging methods, various blood tests, and biopsies are essential for confirming cirrhosis. Visuals. Depiction of diagnostic procedures to provide a clear understanding to viewers. Treatment of liver cirrhosis varies based on the disease's stage, categorized into A, B, and C levels. In stages A and B, where the liver is less damaged, regular medical supervision and treatment can slow the disease's progression and maintain a quality life for many years. The primary goal is to halt the progression of scar tissue in the liver and prevent complications. Avoiding foods and substances that strain the liver, like unnecessary medications and alcohol, is crucial. For autoimmune cirrhosis, immunosuppressant drugs may be used, while antiviral medications are prescribed for viral hepatitis-related cirrhosis. In advanced cases, stage C, liver transplantation might be necessary. Regular checkups and adherence to treatment plans recommended by healthcare professionals can slow the disease's progression and improve quality of life. People with liver cirrhosis have 50% higher energy requirements compared to healthy individuals. While a healthy adult needs about 1,500–2,000 calories per day, those with cirrhosis require between 2,300–3,000 calories. Balancing macronutrients is crucial. Half of the daily energy should come from carbohydrates, a third from fats, and the remainder from proteins. But remember, quality matters. especially when choosing carbs and fats. Fluid and salt management is essential, particularly for those experiencing swelling and fluid retention. Limiting salt to 1 to 2 grams per day and staying mindful of fluid intake can help manage these symptoms. Various foods beneficial for liver health. Artichokes, rich in vitamins A and B. They help slow liver disease progression with their diuretic and antioxidant properties. Multivitamin support, essential for providing antioxidants and vital nutrients to chronic liver patients. Bulgur and legumes. Prefer over simple sugars for stable blood sugar levels. Ideal for maintaining liver health. Processed foods. Avoid fast food and processed meats to prevent additional liver strain. Meat and eggs. Consume in moderation, balancing with plant proteins like legumes. Dairy products. Manage intake by balancing milk, yogurt, and cheese consumption. Grains. Choose whole grains like bread, pasta, and bulgur for better nutrient intake and energy balance. Understanding portion control and nutritional balance is key. Adjusting meal composition and portion sizes can help meet the increased energy and protein needs without overburdening the liver. Understanding liver cirrhosis is vital for early detection and management. If you or someone you know is experiencing any of the symptoms we discussed, please consult a healthcare provider. Early intervention can make a significant difference. Thank you for watching, and remember, knowledge is power when it comes to your health. If you found this video informative, like, share, and subscribe for more health-related content. Take care and stay healthy.